that brings us to the brain. So, yeah.
Yeah, so at the end of the day, that's probably the most important part, is the brain. It's who you are. Without the brain, living longer, living healthier doesn't mean anything. And I think there's a couple of supplements that might help, especially if you've got a history of family history of possible dementias and things in the family. Then you'll use whatever you can to help you.
And I think that brings us back. We had a little bit of a touch with the muscle, but we do think omega-3s is something that helps with your brain health, and we do not test specifically for omega-3s just because it's such a expensive test as a startup, but we can and we have tested before to see where people's omega-3s are. But what we do is we use a proxy for brain inflammation that we test for.
Yeah, so obviously when you see people for the first time, you do a lot of tests, and then you've got a lot of red flags that you first need to try and fix. So as we move down or longer in our program, then we might get to a point where we actually want to test that. But as a first step, no, we don't usually test.
Okay, so we test the homocysteine, which is a proxy for brain inflammation. That's and so for us then, for supplementation, using that proxy of homocysteine, we think there's two big things that if you have brain inflammation, obviously the omega-3s that we then would supplement, and then B12 is the other one. So, and for those two, there are some good studies around that say if you are deficient in both or either, that you can actually with supplementation reduce your risk of dementia.
No, absolutely. And with the homocysteine, it's the B12, B6 and thiamine that's involved with that. So that's a nice screening test that gives you like a little insight in your methylated B vitamins. And we definitely want that level. Usually for cardiovascular health, we'll say, okay, below 10 is okay. But for if you've got a history of dementia in the family, we'll go for below 8 on the homocysteine as a reference point of treatment there. And you're right, your studies clearly show that there's a massive benefit if you do supplement if you are low.
Yeah, and again, it comes to supplementation versus taking stuff all the time. So, I mean, most people's diet is not that stable that they can say, but I follow a Mediterranean diet all the time. So omega-3s might be something to think about in your supplementation. And then with your B vitamins, you can actually test.
And there's two parts to the omega. So it's that the EPA and the DHA. So with the one, it's more for the building blocks of the brain, if we can put it that way. And the other one, the EPA, is more for anti-inflammatory effect that it enhances in the brain, which is quite nice. But you need both of them for adequate results.